The use of face coverings for children has been something that the American Academy of Pediatrics has specifically addressed. Many of our public health departments across the country have looked at this as well. The current guidance is that when at all possible for children certainly over 5 years of age, that they should use face coverings as much as we can convince them that it's an appropriate thing to do. When it comes to physical activity, certainly if it's in the outdoors and it's with a reasonable amount of physical distancing, meaning more than 6 feet, face coverings aren't recommended at all for physical activity or for not. So an isolated stroll in the park or a good jog face coverings aren't necessary. However, if it's indoors and if it's with other people, and if the 6-foot rule is difficult to enforce due to the nature of the event that we're talking about, our best advice is to use face coverings. There is no question that the scientific data has shown that young children can not only become infected, but can very actively transmit the virus even if they're not symptomatic. And for those reasons, the ability and the need to use face coverings is important. There was a lot of concern that young children would have no interest and be very resistant to this. But interestingly, some data has now shown that it's just the opposite. And that if you can explain to them the rationale, that they make it as natural as getting dressed in the morning.